Okay, and that is actually a helpful segue for talking about the focus of tonight's event. Again, thank you very much for joining us. This forum emerged from discussions among concerned faculty and students about what these two budget proposals, the Budget Repair Act for the current fiscal year and the new biennial budget, mean for the most vulnerable populations served by the field of social work. A great many individuals, families, communities, and what the proposals mean for the human service organizations in which we and our colleagues work, and the social and economic policies which we advocate for, help implement, and evaluate. The school wanted to facilitate an exchange of information and thus generate insights for its own community, for starters, about what all is going on here and how it matters. Clearly, the desire for information goes far beyond the School of Social Work. Across campus, Madison, our state and nation, and beyond, there's heavy contemplation of the short and long-term impacts of these proposals. As social work, we are especially, but not exclusively, thoughtful about impacts on employment quality, on healthcare assistance, and on K-12 public schooling. So this evening, members of social work are pleased to have the chance to work through these issues together with all of you. We are grateful to our guest informants for helping us figure this all out a bit better together. Let me very briefly introduce them and hand things off to them for roughly 5 minutes initial thoughts per person, at which point we'll turn it over to a question and answer period. I'll moderate just enough to try to get a little balance across the topics for people. Okay? And again, those topics being employment quality, healthcare assistance, public schooling. Not exclusively, but admittedly that is kind of the design of the event tonight. So first we have Laura Dresser, she's in the middle. She is the Associate Director of COWS. I love that, that is really great. Center on Wisconsin Strategy, COWS. It's a national policy center and a field laboratory for initiatives that promote a competitive market economy of shared prosperity, environmental sustainability, and capable democratic government. She is trained as a labor economist, having completed an MSW as well as a PhD in both social work and economics. She will help us think about the employment issues side of things. John Peacock, right next to me, is the Director of Research and a Healthcare Analyst at the Wisconsin Coalition of Children and Families, an organization focused on improving conditions for families and children through policy change, expanded public investments, and public education that lead to improvements in outcomes and practices in the delivery of publicly funded healthcare, education, workforce development, and social services. He is also the project director of their Wisconsin Budget Project, which analyzes the impacts of state fiscal policy decisions, particularly as relate to low and moderate income Wisconsin families. He's a graduate of UW-Madison's law school and also has a master's of science in resource management. And then finally, certainly not lastly, or at least, Cynthia Moore is a school social worker in the Sun Prairie Area School District based at Horizon Elementary, as well as the social worker for the entire district's 4K program. Horizon is a school of roughly 500 students through grade K through 5, and there are roughly 300 students enrolled in the 4K program in the district. She is a graduate, we are proud to say, of Madison's MSW program. So thank you all very much for joining us. We are grateful for your insights, and we look forward to a rich discussion.
Great. I think this microphone's on. Yep. I think y'all can hear me. All right, well, great to see such a good turnout tonight and to talk about these important issues. And thank you to the School of Social Work for having your eye on this and to pulling this together and providing the pizza, which always helps at this time of day. So I expect, given that you have pizza, you are not allowed to snooze. And hopefully, because we have short talk times, that won't even be an issue. But I guess, you know, sort of the 5-minute summary of what this budget bill means for labor standards in the state, and especially for labor standards at the bottom of the labor market, there's so many, you know, in some ways I feel like I have nothing to say, you know, after 3 weeks of just blabbing. And in some ways I feel like, you know, 5 minutes just couldn't possibly cover enough. But let me cover what I can. And that'll be a nice kickoff. And I think it is good that we moved to discussion to talk about what the issues in the room are. I think, as you all know, and I probably should say this first, and Anna did ask me to do this, so I'm not doing something I'm not asked to do. There has been there's been a call into a session of the Senate. There is some rumor that tonight they will pull out the non-financial items, i.e. the collective bargaining and the Medicaid power grab and probably the power plants, who knows what else. But certainly those things will get, it is rumored that those will get pulled out and voted on tonight. They don't need the Dems to have the quorum to do that. The only reason they need the Dems is they need a 3/5 quorum for a financial item. That's why them running to Illinois held this off. This has been floating as a threat for at least a couple of weeks. It sounds like it may actually happen tonight. And you may, if you are in this room, feel like, I don't want to be in this room if that's happening up at the Capitol. I know a lot of groups are calling people to the Capitol right now. This is, Anna told me to do this. Your safe time to leave if you want to be at the Capitol when they lower the boom. But that's the update there. So you're okay to leave. I'm not going either. We're all still there. I think that in one way it's important to think about there's sort of a narrow financial hit. And if all that had happened was to go after the healthcare and pension money of public workers, we wouldn't even call that narrow. That would have been a pretty big and contentious item, 6%, 8% pay cut. But that's the direct effect of the bill on the pocketbooks of state workers in Wisconsin at all levels, public workers in Wisconsin. So from the state employment and then on down, I think we'll see cuts of at least that nature at county and city, school board, tech college levels. So that's the first hit of this bill. You all know that. The second hit, I think, is a kind of looking forward hit. That what you have right now in all these workplaces is a way to negotiate over a lot of things. The structure of work, the wages you're paid for it, your grievances about it, and pensions and benefit plans. All of that has an infrastructure supported by collective bargaining law, our public sector collective bargaining law that has existed for 50 years in this state. So the second thing is that the bill, as you all probably know by now, makes some specific constraints, very serious constraints on that. So looking forward, nobody can negotiate on anything but wages. Wages can never move faster than the rate of inflation. And looking forward, pensions, benefits, even working conditions and safety, classic useful areas for negotiation, are taken off the table. Those are no longer negotiable. That messes up the workplace looking forward. But I think the final and more important kind of real attack that you see in this bill on working people in the state is the structure of unions themselves. So what it essentially does is turn the state into a right-to-work state for public employees. For those of you who've thrown around in labor issues for a long time, that has meaning. For the rest of you, that doesn't. But basically it says the employer no longer collects dues, and that makes the process of generating the infrastructure you need to negotiate a contract pretty hard. But it also makes just being a union pretty hard. And if you look at the history of Wisconsin and the way that our politics gets generated, basically the big players in the game are not the parties. The big players in the public opinion and who's running for office game are the Wisconsin Manufacturers and Commerce business side lobby and a number of business front type groups and the labor unions, WEAC and AFSCME centrally among them. Those forces have consistently argued for more shared sacrifice when sacrifice is needed, more programs for folks at the bottom of the labor market, more standards at the bottom of the labor market and more programs for people outside of the labor market. So America's labor movement, while caring a lot narrowly about its own members and the grievances of them and the wages for them, has also played a very critical political role. And I think that's probably the one thing to have your eye on when you're watching this. I've done way more than my 5 minutes already, but that's a sort of a summary on, I have to do one more thing. Because I think we all think of teachers first, and that's good. It's mostly teachers. There's 280,000 public sector workers in this state. 100 and I think I just looked at this, 160 work in schools. That's not all teachers. I think it's I'm thinking, 160 work in schools, and about half of them are teachers. And that's, so, there's this question, are public sector workers overpaid? Yes, in general, they earn more than the labor force in general. They also have more college degrees because it is dominated by teachers, and masters, in fact, they also have. At the higher levels of education, actually public sector workers make less than private sector workers in with equivalent training. That's all obvious to you. No one says, I'm going to be a teacher because I'm going to make so much money, right? You know this at the high end. I'm going to go work for the state as a lawyer because I'm going to make a lot of money there. These are sentences that are not said, because that is not why you go work at the state when you get a professional degree. But the other thing you all should know is that at the bottom end of the labor market, actually public sector workers do make more than private sector workers. That's the result of unionization and the fact that unions tend to pull wage distributions together. They pursue equality instead of the disparity that the private sector tends to deliver. And so public sector unions are disproportionately good for the food service, healthcare, childcare workers who are lucky enough to be in them. And that's another thing that's probably worth sort of remembering, that on net, public sector workers are not overpaid, but it is also true that public sector jobs help pull up the bottom. And especially as someone who knows a lot about low-wage labor markets, low-wage labor markets right now, I think the only place with a low-wage job that you get benefits at all anymore is in the public sector. Basically, if you're working in home health or childcare or retail, you're not going to see pension or health care of any meaningful sort unless you're doing food service at the hospital. And so that's just another piece of the puzzle.
Okay, my name again is John Peacock at the Wisconsin Council on Children and Families. And I'm here to talk about healthcare issues, which I hope some of you have been aware that while there's been a lot else going on the last few weeks, there's a huge issue with respect to healthcare programs in the state. And it's been extremely difficult to get that heard over the din of everything else. I was up at the rally on Saturday, and it's a good thing I hate public speaking. Might not surprise you as we go here. But it's a good thing I hate it, because I kind of wanted, I was close enough to the podium that I was really tempted to get up there and say, as important as all this collective bargaining stuff is, that there's something that I think is more fundamental to everybody in the state, and that's our democratic rights, which are being stripped by the budget repair bill. And I don't say that in any way to diminish in the slightest the importance of the collective bargaining law, which affects far more than the several 100,000 public sector employees, for sure. But 5+ million people in the state are losing their democratic rights because what the governor is proposing, and it's totally unprecedented in the budget repair bill, is to delegate to an unelected state official the responsibility of the 132 state legislators to set policy on health care for Medicaid, for the Badger Care Plus program that serves 775,000 people in the state, for the family care program for senior care. There are more than 1.1 million people in the state served in those programs. The decisions on the policies with respect to eligibility, premiums, co-pays, deductibles, services covered, number of times you have to be reviewed for eligibility, all those decisions that are currently set out in the state statute books, the state statute books would no longer be relevant. The governor would delegate to the Secretary of DHS, who's on record as thinking that maybe states should drop out of Medicaid altogether. He would be granted authority behind closed doors to rewrite all those policies. Now there is a check on this. He has to use rulemaking, but not the usual rulemaking. He could use emergency rules, but not the usual emergency rules, which can be in place for 150 days. And then they have to be written as permanent rules. There need to be public hearings, etc. And there's a process for those rules to be referred to the appropriate standing committees where there would be healthcare expertise. Rules would be reviewed in those standing committees. No, none of that. These would be emergency rules that wouldn't have a 150-day time limit. They would have a 4-year time limit. And they would be reviewed by a committee. As is currently written, they would be referred to a committee. They would be referred to the Joint Finance Committee, which is not noted for its particular healthcare expertise, but does happen to be, by long historical precedent, the most lopsided committee in the legislature. It's always, as long as I can remember, had 3 times as many members of the majority party as the minority party. So you couldn't refer it to a more imbalanced committee. But the committee doesn't even have to vote on it. The 2 co-chairs of the committee, both members of the majority party, would decide whether to have a meeting on it or a hearing or whatever. Now, I won't be surprised if they do meet tonight and they do something in a conference committee tonight. My guess is there will be a little window dressing on this, and they'll do something that they claim fixes it, and by requiring that the committee actually have a hearing and vote on it, which would then get you would then have at least 16 members of the 132 in the legislature who would have to be on record. But most of us would be totally disenfranchised. I mean, we expect that, there's a reason why governors have 4-year terms and members of the assembly have 2-year terms. The governor gets to be in there and lead for 4 years, but he's got to get his things passed through the legislature, and those members of the assembly have to run on those votes in that interim election before the governor's up again, and we can hold them accountable. That's out the window. We won't be able to hold them accountable. Now I'm going to talk just real briefly about the budget bill, which cuts $500 million out of Medicaid. I mean, it actually provides more funding, but $500 million less than it would take to fully fund these programs going forward in state funds, and then that's multiplied by almost 2.5 to 1 in terms of the total when you count the federal match. So a cut of well over $1 billion from the Medicaid-related programs. And I'm going to talk to you about the provisions in the budget bill that relate to the Badger Care program that serves 775,000 people. I'm going to tell you everything I know about that. Okay, we're done. There's nothing. There's not a word in the budget bill about the structure of Badger Care because, and it should be no surprise to anybody who looked at the budget repair bill, it's no longer the prerogative of the legislature to make those decisions. So it doesn't, so you may read in budget summary documents that they're talking about various changes like reducing eligibility down to 133% of the poverty level, which for a single person in Badger Care Court would disqualify you if you were earning the minimum wage and working 40 hours a week. For a family of 4, 2 parents, 2 kids, both parents working minimum wage, they would be over the 133% income limit. Those parents would become ineligible for Badger Care. Anyway, there are documents that talk about the options, much higher co-pays, cost sharing, reduced benefit packages, all these things. But we don't know. The budget document doesn't tell us, and because it's not up for the legislature to decide. And so while it's a good thing I don't like public speaking and didn't get on the podium before the crowd on the weekend up there for collective bargaining issues, among others, because I might have wanted to say there's something even more fundamental at stake here.
And I too am not a public speaker, but I think of myself as more of a behind the scenes worker and as a school social worker, but a little bit about how the schools are going to be impacted. And I'm looking at it more from a macro sense, because really at this point, we don't know in the schools how it's going to affect each individual school. And it is like, Governor Walker was saying, giving local districts more in their toolkits. Well, those decisions are going to be made at a local level. And I am going to stay away from the numbers because research methods was also almost the end of my social work career. Dr. Jane, if you're in here, but I made it through, so I won't go too heavy on the numbers. But, according to Governor Walker, $834 million, about 8% would be cut from school budgets. And he is introducing plans to eliminate grant programs for bilingual or bicultural education, advanced placement courses, alcohol and drug prevention programs, school nurses, alternative and at-risk education, science, technology, engineering, and mathematics education. At the same time, he's proposing to expand the school choice program. And I know people have varying thoughts on that, but my personal thoughts is that it will end the public school. It will end public education if the school choice is expanded. And not to speak against private schools, but once again, when you expand school choice, he's going to end also as well those eligibility requirements, income requirements. So that means that the families who are more well-to-do, they will get a waiver at taxpayers' expense. And once again, private schools, when you look at accountability, they can pick and choose which students they would like to go to their schools. So children with disabilities, children with behavior issues, they can very politely be asked to leave, and then where do they go? So we're looking at the impact on the students as well. And just in speaking and listening to you speak as well, schooling doesn't occur in a vacuum. Our children kind of are a product of their environment. So when they come to school, whether they're ready or not, we have to take them where they're at. And so if mom and dad are unemployed or homeless or parents with mental health issues, those are all the things that we're dealing with in schools. So it's not just, okay, today we're going to learn about math, sit down and learn, it's all easy. These children are coming to school with some very significant mental health needs as well, and they don't have access to some of those services. And I think that's one of the biggest struggles that we're facing in our schools right now, is we have a significant number of students with mental health needs, and they do not have access to services.
Questions?
Can we do the mic?
Yeah. Here's the mic. You can go started. Yeah.
This question is for Laura. I've read recently that sort of the successful union busting might be the demise of the Democratic Party altogether, and I'm wondering if that's plausible or realistic and what your thoughts might be on that.
It's the demise overall of the Democratic Party. Well, I don't think it'll be the end of the Democratic Party. I think it is a successful campaign of union busting is seriously undermines the most, I think, many of the most progressive forces in the Democratic Party. There's a pretty strong business-tied wing that will be able to raise money in a lot of conditions, especially if it looks like they're going to win. They'll be very good at raising money, right? The Dems, have played all sorts of games and have all sorts of alliances with people who are not unions. But I think in many ways, and actually at a state level, the people who are paying attention to state budgets, state services, and advocating for the kind of candidates who care about a kind of broad set of progressive issues, I think would be pretty substantially undermined in the Democratic Party. I was reminded of one thing. See, I go on, which isn't exactly on your question, but it's sort of related. We're having a conversation. It's related to Michael Moore's speech, sorry, which I didn't see, but I read, and I recommend that you all read. But it's this. We're having a conversation as if we are a desperately poor nation in desperately tragic times. And I just think it is worth remembering we are the richest nation on the planet at, a little overall down, certainly a giant downturn, but still actually our total GDP right now is bigger than it was in 2007. No, maybe it's still a little short, but whatever. So 2007 was as big as this economy ever got, right? And we are having the kind of discussions about whether kids should get mental health medication. And so, I throw this, I know you all know this, but I just remind you of that. We are a rich nation, we are not a poor nation, and there are different ways to solve these sorts of problems. So far.
It's purple and then blue.
John, could you talk about the 3 programs, Medicaid, Badger Care, and Family Care? How would you assess their quality, their appropriate funding up to date? Are there any problems with this programs that need to be fixed, et cetera, et cetera?
So you asked about Badger Care and senior, was senior care on your list or?
Well,
or
all of them
family
that
care?
sort of
Yeah.
seem to be in this envelope, which is saying that we have major problems, we have to bring it into the office of the secretary. I'm wondering, I've always heard good things about them, so what's your assessment?
Yeah, Wisconsin is known nationally for its leadership in healthcare. We have one of the lowest rates of uninsured people in the country. We have, I think, one of the broadest packages of benefits in Badger Care Plus. It's administered very efficiently. It's really a national model in a whole lot of ways. And up until at least the end of December, Wisconsin was one of the top 2 or 3 states in terms of the implementation of healthcare reform and developing a system for integrating Medicaid and Badger Care Plus with the new exchanges. And we were the first state to develop an online application system that there's a prototype that you can see on the healthcare reform office website, a prototype of sort of a Travelocity for healthcare that would be in place in 2014 for buying health insurance to just show what it might look like. And that's really a national model. And it hasn't been taken down yet. I was pleasantly surprised to learn. But getting back to your question, the programs are very good. Are they perfect? Far, far from it. Badger Care Plus, getting access to dental care is a huge problem. Getting access to mental health care for kids and parents is a very big problem. The reimbursement rates for those services and some others aren't what they ought to be. And there is a major fiscal challenge. And during the recession, the bottom really dropped out of employer-sponsored health insurance. There was this, at the same time that state revenue was plummeting, these programs were exploding in enrollment, or Badger Care Plus was, and the federal government came to the state's rescue and provided an infusion of money through the Recovery Act that got us through the last biennium. And in fact, it was actually somewhat more than we needed to keep those programs going. So we backed out some state funding from those programs. So now when they say that there's a $1.8 billion shortfall in Medicaid and Badger Care Plus, that is in fact true. That much of the reason for that shortfall is that we had this infusion of well over $1.3 billion from the Recovery Act, and now that's gone and it opens up this big hole. But there are very significant challenges in terms of financing it. I think the state does need to find ways to control or to slow the growth of the cost of those programs. But a big part of that is to slow the growth in the cost of healthcare in general. I mean, the growing cost of Badger Care Plus is a function of the growing cost of healthcare and increased enrollment as employers are dropping coverage as the labor market changes and more people are working in the service sector. But so there are significant fiscal challenges, but there are much better ways of addressing them, and however we address them, the legislature ought to be voting on those options.
as if most of the publicity in the newspapers has been around the labor issues, with less attention to the issues that you mentioned, which are really, really important also, healthcare and the issues affecting schools. I'm wondering how we can advocate that these issues get more attention. And also for those of us who are fortunate to have more money than expertise, is there any way that we can contribute money so that those who have expertise are able to spend more time giving these issues more publicity or whatever? Anybody want to be hired? Anybody want to be hired up there?
I think there are any number of good organizations that are sort of very active right now, and organizations that are forming by the day, and probably Wisconsin Wave and Liberty Tree and others that I hadn't heard of a week or two ago. And there are groups that do the nuts and bolts issues on budget, policy stuff that all of a sudden people realize is important. And we would love support from anybody. We're always struggling to have adequate staffing to look at budget policy issues. But I will just give a plug to, if you want to follow budget issues, Wisconsin Budget Project.org is one place to do that. If you're interested in the healthcare issues, SaveBadgerCare.org, and the Save Badger Care Coalition, which has just been formed in the last couple of months, has been doing some really great work, and we've been real active in that work. And you guys have some ideas on this question too.
And just from the education standpoint too, I would just really encourage you to go to your school board meetings in your community and speak and make your voice heard there as well, because I think that's very critical. The school boards are very receptive to the public, and they want to hear how the public is feeling about that. I think depending on what area you live in, sometimes it can be very one-sided and lopsided with certain views. So I just really encourage you, whenever you have the chance, to go out and go to your school board meetings and speak up.
I have a question in regards to Katie Beckett program. My son has Down syndrome, and I'm just middle class. My family is, and we're married. And when you mentioned about the two-wage, two-earner, if we get to that eligibility like too high, Unity doesn't cover anything, so Katie Beckett picks up on that. And if he's not allowed to cover because it's developmental delay, so we need Katie Beckett. And if we don't have Katie Beckett because of eligibility, where are our families going to be left? I'm certainly not the only one. Is it, you get a divorce because, to work the system, I definitely don't want to work the system, because I review our patients for community care program through the Medical Foundation and the hospital and clinics, and I see a lot of people try to work the system, and it's just a vicious cycle. So what are your thoughts? This is for John, and actually, for Cindy too, of like what I could do for my son, and for developing and getting into the school system. And John, for sure, about Katie Beckett, my goodness. Loaded.
And this is a concern too as well, because in the budget bill, special education is going to be left relatively untouched because it is a federal program. But what we are going to see are things like family support and resource, which provides support for families who have children with developmental disabilities. Those budgets are going to be cut, and they're going to be slashed. And so once again, it's kind of being on the ground floor, trying to work the system, help families navigate, to try to find the resources they need. So it is definitely going to be very difficult, I think, to help a lot of our families to find those supports. So that's where children, I think, with disabilities and those families are going to be impacted the most, is those outside community resources are going to dry up. And I don't mean to be like doom and gloom, public education is ending, and there's not going to be, but a lot of this stuff is going to undermine public education, and it's going to be very hard to make sure that all children get the equal education that they deserve.
What am I left with?
Yeah, and that's what, and that's what we have to do. It's very scary for our families. And we've gotten lots of calls like, okay, well, I have to hurry up and try to get eligible for this program before the budget because I'm not going to be able to get in, And what's going to happen, at least in my opinion, is they're going to take the hardest cases first, or the children with the most severe disabilities, and the one are kind of like, oh, you're not as bad as this one, so we're going to take, it's going to be a picking and choosing, which is really sad for the children.
I feel a little bad by what's been going on in terms over the last few weeks, and by those of us who are sort of setting off alarms about it, because we're scaring some people who I think aren't going to be affected. Now, had you asked me a couple months ago, did I think anybody needed to be worried about collective bargaining rights being totally stripped away, I would have said no possible way. Yeah, they're going to go after benefits. He talked about that in his campaign. Sure. But, going after collective bargaining rights altogether. I mean, maybe I'm naive, so I kind of feel bad that on the one hand that we're saying we have no idea what could happen, and there are more than 1.1 million people for whom the control of these programs would be turned over to somebody who's on record being kind of opposed to Medicaid. I don't think anywhere close to 1 million people are going, well, maybe close. But some of these programs, Katie Beckett, I feel like 99% sure wouldn't be touched. And one thing I did neglected to talk about is that there are federal laws in place for now that do provide some degree of protection. There's something called maintenance of effort or maintenance of eligibility standards that were in the Affordable Care, or in the Recovery Act that only lasts until the end of June, but also in the Healthcare Reform Law, the Affordable Care Act. There are these maintenance of effort requirements that say that states cannot, between now and 2019, reduce eligibility of kids, period. That applies to income eligibility, that applies to things that affect eligibility, like the amount of premiums, the number of reviews a year, those kinds of things. And those provisions say that you can't reduce eligibility of adults between now and 2014 unless you have a deficit. So that's a little loophole that about 49 states can slip through, but they're allowed to reduce eligibility of adults down to 133% of the poverty level, which, as I was saying before, is sort of for the Badger Care Corps plan, which serves childless adults. That's for one person. That's 133% of poverty, is roughly equivalent to the minimum wage, slightly over. But there are these limits on what they can do. Now, that should be of some consolation to those of you who care about these programs. However, the budget repair bill directs the department to apply to the federal government for a number of waivers, including a waiver of those maintenance of eligibility standards. And I talk as often as I can to sort of folks I know in DC, who work on the Hill and elsewhere, and clearly the current administration in the Center on Medicare and Medicaid systems does not want to waive these maintenance of effort requirements. However, in Congress, they already passed a bill in the House to totally repeal those provisions in the Affordable Care Act. They're working on a bill to block grant Medicaid altogether, to just turn the funding over to the states to use it however they want. It would no longer be an entitlement program. And that's clearly not going to happen. But then the next step is to repeal these maintenance of eligibility standards. And they're just, at some point, the Senate has to give some ground, because the House can block funding and other things that are needed for the implementation of healthcare reform. So the House has some leverage, and the Senate might give in on some of that stuff. Now, there's no scenario I can think of where we would undo Katie Beckett. Could we trim some of what we covered? I doubt it. I don't know. But again, I wouldn't have said that they'd go after all of the other bargaining rights.
John, can you briefly define what key Beckett is?
No.
Back to you.
In a word.
Target population or
So to reiterate, oh, I'm sorry, to reiterate, you were talking about how this is, Katie Beckett is basically federally protected. I mean, is that kind of what I got from you? Even though it's a state program. And where is it that I can find this information about the maintenance of effort, you know, like, and also what else can I do proactively to make sure that nothing changes, kind of like the collective bargaining, you know, and then today, you know, like, even though you're 99% sure, there's 1% that this mom wants to make sure I'm doing everything possible for my child.
Well, if you live in this area, I certainly, Congressman Baldwin is going to be a strong supporter of the maintenance of effort requirements. And while I worry about Senator Cole wavering on some issues, I've talked to his staff. He's not going to waver on this issue, the maintenance of effort. Our other senator, what the heck, give him a call. But no, I shouldn't say that. I'm sorry. In terms of sort of a little more information on maintenance of eligibility or effort, I did a paper that you can find on the WCCF.org, the council's website, or the Wisconsin Budget Project.org. There's a paper there that I wrote in mid-September about the implications of Medicaid-related changes. And there's an appendix in there that tries to summarize the maintenance of effort requirements. But it's what states are currently allowed to do. It is in effect, it is just roll back eligibility of adults, but not adults with disabilities, not pregnant women, but they can roll back parents and childless adults to 133% of poverty. That would be a lot. Now, what the department says, what Secretary Smith says, is that we don't want to do that. And they shouldn't want to do that because reducing eligibility levels is just like the highest, it has the most visibility, and it's going to generate the most public reaction. You really, if you want to control enrollment and not take a lot of grief for it, is do the more subtle things. And those of you who've sort of worked in the field probably know that navigating these systems can be difficult. And if you have like reviews instead of annually, twice a year, there's always people who get tripped up when their review comes up. The system never works quite the way we think it ought to work. And so having twice a year reviews, which is something they want to do, that's going to knock a lot of people off, requiring more verification, just more and more red tape, those kind of things. And what's really the worst thing about that is that who that affects are the lowest income families. It's not the ones who maybe sort of have a job where they do have an offer through their employer and they can't quite afford it. No, it's the lowest income families with the most barriers who are tripped up by additional red tape. And that's, I think, the direction that they're going to go.
Okay, thank you. Next question.
There was some information in the newspaper today about changes that this will make to the W-2 program and childcare subsidies. Can any of you talk about that?
I'm not sure if I saw that article, but there's a big drop in funding for the Childcare Subsidy program. It looks like that drop is largely as a result of what's gone on over the last year, where there was the abuses of the program in the Milwaukee area in particular, crackdown on that. I think that crackdown went too far in a lot of ways and has really hurt a lot of providers by all kinds of additional requirements and changes in how we reimburse, et cetera. But there was abuse, and it was very unfortunate because the reaction was predictable and has, I think the pendulum has swung too far. But that has dropped participation and spending way, way down. And that drop might be enough. I mean, the cut in the program is like $100 million a year from the base, but the reduction in spending is close to that. Now, what the bill does, it's very similar to what it does in healthcare. It gives the department the authority to reduce eligibility, to establish waiting lists, and to increase the co-pays by participants in the program. And there'd be no legislative oversight. There isn't even the emergency rules that would go to the finance committee for the two co-chairs to decide, should we have a meeting or not? No. There isn't even that for this. But we're kind of crossing our fingers. We're still kind of crunching those numbers and kind of hoping that it's not going to come to that because of just the sharp drop in spending over the last year.
And W-2, well, other things but W-2.
We'll come back to that.
And two, just once again on the ground level here with the childcare subsidies. I do work for the 4K program, and basically that program allows a child to attend the district 4-year-old kindergarten program for 2 hours, which is free of charge to the parent. But what happens is a lot of working families then need what they call wraparound care, and that's where they use those child care subsidies. And often I have families that lose, for whatever reason, they haven't met with their case manager, or they lose their child care subsidy, and then they pull their child completely out of the 4K program. And these are a lot of the children that really we need to get prepared and get them ready to be into kindergarten. These are a lot of our more fragile families where maybe they don't spend as much time reading to their children or doing a lot of the language-rich activities that a lot of other families do. So I mean that has that impact as well in terms of the child care subsidies being lost.
Actually, I want to go back to the office this evening to prepare a presentation for tomorrow. I have to figure out the W-2 part, but I can tell you a little bit about it. There's a $20 reduction in the cash benefits for people who are in the program. I don't think we've ever increased those cash benefits. I think they're what they were set at back in the mid-1990s when the program was created. But the governor said we're increasing that by $20 because it was just amazing wording somehow to give people a greater sense of the importance of returning to the workforce, or the real workforce. It's not, I don't know. But so there's that change. There was a positive change made by the legislature and the Doyle administration a couple of years ago, where they let people in the program, and they have to work to get these cash benefits, but they allowed them to combine some education and training with the work. That's being repealed. I think there are a number of changes that I haven't gotten a good handle on the length of time that you can be in different stages of W-2. And the wording on that is kind of confusing, and I haven't figured that out. But that's all very worrisome. And the governor said that he wasn't going to rate any funds the way the Doyle administration did at times, in terms of like taking money out of the transportation fund and using it to help balance the general fund. Evidently the TANF funding, the Temporary Assistance to Needy Families block grant, that federal block grant for welfare reform evidently doesn't count, because the governor is taking $37 million a year in this current fiscal year through the budget repair bill, and in each of the next 2 fiscal years, using that money for a lawful purpose of helping to pay for the state's earned income tax credit, but backing out state funding from the earned income tax credit, so that over a 3-year period, $111 million of state money would be used for deficit reduction, drawing down the balance in the welfare reform block grant program that we need for W-2 and Wisconsin Shares Childcare Subsidies, et cetera, and the new transitional jobs program, which he proposes eliminating. So he's balancing the budget on the backs of the poor while providing more capital gains tax breaks and more tax breaks to corporations that have figured out how to shelter their income in other states.
Question?
Thanks all for coming. This is really wonderful. I was hoping to leave this room with sort of 3 talking points. And since there's 3 of you, I was wondering if you could each give, what is the most important sort of egregious thing that's about to happen in, maybe like a sentence. And just going back to the lady down in blue, we've been talking about collective bargaining rights because that's really easy to say in 1 sentence. And I think that we're not talking about these really important issues related to healthcare and education and children because they're much more complicated. And so if there's a way that you guys could, sum it down so that when I talk to my friends about this, when we all talk to people when we leave, we can very easily say, no, there are going to be 40 kids in the classroom with 1 teacher next year.
Well, I'm a numbers guy and I could throw out all kinds of numbers, but I think that in 1 sentence, the key is the loss of the basic democratic principle of having our legislators setting state policy and being able to hold them accountable in the next election for those policy choices.
Well, I'm sort of more the labor sentence that you sort of already have. But I feel like, to me, there's a kind of fundamental sentence. If this was going to all be about job creation, why is the first most active thing you can do attacking the labor standards of 280,000 workers in the state?
And Madam Gloom here. I feel like I've just been like, everything's gonna go. No, I would have to say along the lines of what you were saying, Phil Dosman, who's a principal with Milwaukee Public Schools. Milwaukee Public Schools stands to lose $59 million with this. And he did send out a letter to parents, and he shared this with me as well. But what they're looking at is 35 students to a classroom. No art, no music, no gym. After school, homework clubs gone, and a reduction in the breakfast program, which that's really a very critical part of our schools. Our children depend on their breakfast and lunch programs.
Thank you.
Eric, you have a question, and I'll come down here.
Okay, thanks. I think this is probably a question for Laura, but the other 2 might want to chime in. I've heard a lot.
Oh, no, I'm talking to her.
Oh. Getting signals from Tracy. I've heard a lot about the 2-year deficit, right? Not the immediate deficit that they're dealing with. And I think it's $3.2 billion deficit is the figure that gets tossed around. But I've also heard a counter argument, which is that's actually a fairly inflated number. And I'm just wondering if anyone could speak to that in terms of what's the reality about this 2-year deficit? How certain are we of exactly how much money it is? Because I'm curious about, what is the actual gap that needs to be covered?
Yeah, whenever I get the what is the actual gap that needs to be covered, I call John.
Research methods.
This is an area where I tick off some of my friends in organized labor who sort of all of a sudden, all of us back when a couple months ago they passed $117 million in tax breaks for wealthy people in the state and corporations. And a lot of us were saying, the deficit number is on the order of, and it's bigger than 3.2, it's on the order of 3.5 then. And they made it 3.6 through, and we weren't broke then. Some of us were trying to say, we're getting close to being broke, and let's not do these additional tax breaks, and the governor didn't agree with us then. But now we're broke. And that's not true. The state takes in over $1 billion a month. I don't call that broke. But we have a pretty serious fiscal situation. That's clear. It's about $3.6 billion. I don't think they've really cooked the books on any of this. Not on that number, they haven't cooked the books. And $3.6 billion is the equivalent of cutting about 75% of the funding for the UW system and 75% of the funding for the correction system combined. That's a lot. Now, on the other hand, it's 12% of the state budget. It's a biennial number, just to clarify, but the state budget's typically about 13 billion general fund dollars a year. That 12% puts us in the middle nationally. I mean, we're not, you would think from everything you hear in the media, given what's going on here, that we've got like the most horrendous budget situation nationally, that we've got bloated state spending, that we've got a bloated private or public sector. There are actually only 12 other states that have fewer state and local employees relative to the size of the population than Wisconsin does. In terms of taxes and spending, we're a little below the national average when you measure it on a per capita basis. Now, we're also a poorer state, so if you measure it relative to income, we don't do so well in the rankings. But our spending and taxes per capita are below the national average. And in terms of like indebtedness, we're I think there are about 11 other states that have less debt per capita than we do. So we're not in a crisis, we're not broke, but we do have very significant fiscal challenges.
And the only thing I would add is also is that the scale of this budget problem is slightly smaller than the last biennial budget. And we actually have been generating structural deficits since the Thompson administration in the billions ballpark. We have papered them over. McCallum used the tobacco money to paper them over. We used Thompson, got blessed by incredible economic growth, and that's how he could just keep put the money out. But anyway, so it's also not enormous even relative to what we dealt with on the last biennium.
So if I could just follow up, in terms of, my understanding is that the 3.6 billion is a figure that reflects the difference between the requested budgets and the expected revenue. And then where I've heard that this is an inflated figure is that no one ever gets exactly what they request, and they always request a little high. And if expected revenue is a little higher, on the order of a percentage difference in terms of GDP growth, then you could have a very much smaller figure in terms of, because I'm trying to understand whether or not this is a crisis that's structural, that requires restructuring, or at least major new revenue, or if this is something that's temporary, it's a product of a recession, which is eventually going to go away, and therefore shouldn't require the kind of massive changes. And I'm asking this because it's speaking to the talking points. When you're talking to people about this, a lot of people will say, but we are in this huge emergency. And 3.6 sounds like an emergency until we kind of put it into context.
The 3.6 billion is based on agency requests. Now, those are agency requests that the agencies weren't allowed to go hog wild by any means. And basing it on agency requests that actually reflect the real cost to continue programs, that's the right way to do it. And for years, when the Doyle administration would submit requests, and they'd use those requests to come up with what the deficit was, and 2 years ago it was $6 billion actually. And the Republicans all said, oh my God, but that's way too high, it's nowhere near that bad. That's based on agency requests. We shouldn't be doing that, we should be basing it on flat funding. So there's this total role reversal now. It's kind of amusing. And kind of tragic. We need to come up with a way of actually, a consensus way of coming up with this. And one of the reasons why we need to do that is because there were people like myself and others who sort of knew it was going to be upwards of $3 billion last August, September, October, who kept trying to say during campaign season, you're talking about all these additional tax cuts and everything. How can you possibly do that? And it was poo-pooed, and we need to come up with a way, a consensus way of measuring it so we can have realistic discussions and not get caught in this trap both before the elections and afterwards.
Okay, next question.
I'm glad you addressed it that was my initial question, was the "we're broke" argument, because I think that's how the poison pill is being fed to a lot of folks, and that's why a lot of people are going to be willing to take on some of these cuts because of that belief. So I think the talking point is we're not broke. That we agree. But my other question was, a little while ago, there were a bunch of folks, many with disabilities, who marched and wheeled into the Republican office and stated, this is back to John's point about what sorts of protections are going to exist for folks. Because I heard you say eligibility standards for kids and people with disabilities and some of the more vulnerable groups are going to be protected federally. And is that true? So are the folks that were in the Republican office saying, I'm not going back into a nursing home. You can't do that with this bill. Where does that stand?
Well, so when I said that people were protected, and that's true, I think where it gets a little dicier, and I don't know about the situations of some of the people with disabilities involved in those protests, but one thing I haven't talked about yet is the state's family care program. And family care is a program in the state that provides community-based services to help people stay in their home oftentimes, or typically, and it serves people with disabilities and seniors, and it saves money by keeping people out of institutional care. The one challenge of a program like that, while it does save money, you end up, when you make something like that available, you end up kind of broadening the net and serving some people who've been sort of succeeding one way or another in staying out of institutional care, but you give them a home-based option that they've needed for a long time, and it ends up increasing your costs on that way. But the state, and I'm no expert on family care, but the state's been expanding that gradually. I think it serves like 55 counties now. The commitment of the state was that there would be no waiting lists as counties go into this. The governor's budget cuts $111 million in state general funds for family care, $284 million in total funds for family care. The result of that is going to be to freeze the number of people in each county that it serves. There will be waiting lists in counties that haven't had waiting lists. There will be increased waiting lists in counties like Milwaukee that already have them. And there are people who thought they were with disabilities who thought they were going to be served through that program who won't be served. That is not affected by those maintenance of eligibility standards that I talked about, and for complex reasons that are perhaps beyond me.
What was that number again? 148?
It's $111 million in state general tax dollars. And what you add in the federal match to that, the total's $284 million. I'm a numbers guy.
My question is about women's health and family planning. I've heard that family planning is going to be affected by this budget bill. Could you talk a little bit about how and what impacts might happen for women's health?
There is a big cut in funding for family planning, and I'm trying to remember now sort of which portion of it, but there is a significant cut. I think that there are some parts of it that the governor hasn't gone after yet that he's going to eventually. Wisconsin serves teenagers down to the age of 15 in this broad authority that would be granted to DHS. I think that would be one of the first things to go, is to raise that age up to 18. But I think if you look at, there's a Wisconsin Women's Health Budget Project that has written a lot about this, and certainly Planned Parenthood. And on their websites, you can find a lot about this, and we'll be linking to that information on our website. But that's about the extent of my knowledge of it.
I have the next question. So we talked about EITC taking hits and not being as a big incentive for work. But so EITC is a huge incentive to get people into the labor market, and then with childcare, we're losing that, and all these other kind of work supports. What's the expected fallout of where are these people going to go, and what's going to happen?
before I get to that, because I'm stalling because I'm not sure what's going to happen. But while I said that he was raiding this ton of money to pay for the EITC, what makes that all the more offensive is he's cutting the EITC. He's like taking this funding, but yet the amount that's left for the EITC is reduced by $41 million over the next 2 years. And for what that means for like a mom on minimum wage with 2 kids, she's going to lose about $300 a year from her earned income tax credit. They argue, we say, hey, you're raising taxes for these folks while you're reducing taxes for the rich. I say, no, that's spending, it's not really taxes. Tell that to that mom, who's going to see a 43% reduction in her state EITC. Where are people going to go? I mean, you guys are in social work. You can speculate on that as well as I can, I think.
And two, just in terms of kind of less of where, people are going to go, but what we're going to see too, as well in the schools. I mean, I think as someone had mentioned earlier, things like dental care are not covered. So a lot of what we do as school social workers, we go to dentists, we ask them, hey, can you see this? Student pro bono. Fortunately, in some Prairie, we have a lot of generous, dentists who will see students, free of charge. But once again, those families are going to have to make those choices. Do I take my child to the dentist, or do I pay rent, or do I pay for my medication? And I think that's another thing that we're going to see in the short term happening to our students is that the co-pays, I'm sorry, I'm being such a downer, but a lot of our students are not going to be able to afford their prescription meds, whether it's for ADHD, whether it's to control some of their mental health issues that they have. So I think that parents are going to have to make a lot of choices, a lot of tough choices, especially those that are at lower income levels. But we're also going to see, some of our middle class families that are just making it, getting hit as hard. And with some of these proposed cuts, even at the school level for like reading resource, that cuts across all income levels. Also, we have students of every income level who are struggling with reading. And these extra supports have really helped keep them and get them to grade level. And when those are cut, that's going to really harm, once again, our students.
The bottom line on a labor market, right, is that desperation makes people willing to put up with a lot. A recession makes people desperate. A 9 or 10% unemployment rate makes people more desperate. The lack of supports outside makes them more desperate. All of this makes people more prone to putting up with everything on the job, from illegal behavior by their boss to not demanding their overtime pay when they should be getting it, to accepting a kind of standard of hours delivery that they never would have accepted in a better time. That is, I only get called in once a week, but it's the only job I've got. I think this is the obvious thing, but that, every social safety net we have is a piece of what helps people stand up at work, right? Whether they use it or not, they know it's there. And the more you rip that up, the more people duck and cover at work and take whatever they can. And that's, and I think, this has been a very long-term trend in the way we treat both labor standards and the supports for workers outside of the labor market. We took away TANF. Everybody said, what will they do? Well, everybody relies on their family a little bit more, begs a little bit more for work, and puts up with a little bit more crap there, sleeps on more couches. And, what will people do? Hopefully at some point we get, enough people who think this is appalling that we start organizing up both on the labor standards and on the work support side of things. But, right now it's the worst possible context because it's a recession in the first place. Set the final downer.
I have the next question. It relates to the eligibility for income maintenance centralization. And what does that mean for workforce to privatize those jobs? And will this really save money? And also, what does that mean for families?
Well, they're budgeting savings of $48 million a year for that.
Can you decode that question just a little bit?
Yeah. So the budget bill proposes transferring the current income maintenance system, the whole intake and renewal system for public programs. It proposes transferring, at least I think it maybe is limited to the Medicaid and food share portions of that, would leave in the counties the child care, and I'm not sure what's left, but most of it would be transferred, at least ever so briefly, from the counties to the state. I think there are currently 1,200 workers around the state in the counties who do income maintenance work, and those positions, and 1,200 who do that work for food share and for Medicaid, Badger Plus, and those positions, I think 900 of them would be transferred to the state, and 800 of them are probably going to be privatized. And where those jobs are going to be, I have no idea. I think they'll want us to believe they're going to be in Wisconsin because we're open for business. But I'm not sure that we know that. That where there's going to be a net loss of 270 jobs, and their argument is this is all going to be automated, and it's going to be more efficient, and that it will provide better service to the people in the program, and I'm all for automation, but this is an area where we want to look real carefully at the experience in other states that have privatized their systems. I know Texas did it, I think about 4 years ago, and that was a total disaster. Anyway.
Ready for the next one? This is for Dr. Doom on the right. I'm wondering how you envision the cuts to schools and program funding, and then also the expansion of the school choice program. What effects you imagine that'll have on the educational attainment gap?
Well, right now, one of the school goals or district goals is to close the achievement gap between Black and white students, and a lot of that is done through some of the extra programs that the district offers, whether it's Read 180, math supports, so various things along those lines. So definitely with those being cut, we are going to see probably the gap increase more, whereas we've slowly been closing the gap, and it's still not closed. I'm not going to say that everything's perfect, we've made it, and that we're there. We're not there yet, but I think that this is going to definitely set that piece back. In terms of the expansion of the school choice program, I was a private school teacher, I was a public school teacher, and now a school social worker. The expansion of the school choice program, what concerns me the most about it is, one, reducing those waivers where parents of any income level can have their schooling paid for at the taxpayer's expense. Also, to the fact that private schools, they don't have the same accountability, where they can just ask certain students to leave if they don't meet their behavioral requirements, or children who have autism. Maybe the private school does not have the ability to educate those to those children, so they can just say, you probably should go to public school where they can better meet your needs. Well, then we're going to end up with a creaming of the system. But, the top kids will kind of go to the private school, and then some of the other struggling children will kind of be left in these public schools. So that's my concern about the choice program. You had one more. There was one more thing about the cuts.
No, that's pretty much it.
Glad to add a little more to.
I think it just, because both of these questions were about privatization, I think it is a kind of worthy theme in this and a thing to watch. And it is such a vicious cycle, because what you get is you get privatization that then tends not to work very well and undermines support for the program. We've seen this played out at the federal level, and we see it played out, and it's one of the dynamics also on the privatization of schools, but the Medicaid thing will be the same way. Because you just don't have the accountability structured in, so you make an argument about privatizing to save money, and in the end you get neither accountability nor actually that much money out of it.
I
had a couple of questions about impact, and one is what's the impact for the counties, because many of them have already seen really sharp reductions in their ability to provide services, and they do job sharing across positions for the state type of run positions, the county positions. They might share workforce development and some other things, and so to lose a person really isn't to lose a person but a percentage, and so I'm wondering about the impact of that. And my second question is really what's the impact on the public sector. One of the things that I've heard a lot among my colleagues is that if there's a sort of private person, I didn't mean public sector, but private, if there's a private working person for a corporation, say, then they'll be transferring benefits over to the private payee, as opposed to having the public sector person carry the benefits as they have in the past. And I'm wondering if there's been any calculation of the costs to those private providers, because I'm thinking in terms of advocacy, they'd be interested to see how much all of this is going to cost them when they have to start paying the bill for these insurances for families.
I'm not sure, frankly, how. I don't have an answer for that. I do think that with respect to your first point about the county employees, I think that point's very well taken, that there's just going to be sort of all kinds of sort of ripple effects and unintended consequences through all of this. I mean, just all the little various places where getting rid of collective bargaining is going to cost us money because it, like on mass transit, we're going to lose $46 million, I think, a year. There are various, but because the feds require us to maintain collective bargaining in order to be eligible for certain federal aid for transit. And the ripple effects of that, as I was talking to somebody from Wausau last week who was talking about their system being shut down. And they have buses that they purchased with federal money that when their system shuts down, they have to pay back money that they used for those capital purchases. They have, I mean, there are people with disabilities and the elderly who are relying on those transit services, and the school system. And so the school's getting hit through all sorts of different ways, but the school system gets a benefit out of those transit services. And just the ripple effects from all of this are just really kind of unimaginable. But I'm sorry, I can't answer the other part of your question.
I do think there's a job effect that, you know, part of the argument that Walker has made is I'm asking for these compensation concessions on pensions and healthcare in order not to lay off workers. And he took this, you know, 6% hit out of 6 to 8% hit out of the state workers. But he has handed over to the schools and the local units of government a 10% across the board sort of cut, which you can't take out only of work. You know, if you only take even 10% of all your workers' salary, you're not going to cover his cut. And so it implies either taking 20%, depending on the share of the money that's going to workers, or laying off workers, right? That's what a larger classroom is. So I think, you know, the implied effect on the local units of government is a net job loss. Oh, the only way to imagine it is a net job loss, and I think that's what, you know, one of the tools he's going to do. Yeah.
Can I just add to that real quick? Kathleen Falk released her official memo today, first stating that all discretionary programs will be first to go, which is actually my internship at Joining Forces with Families, so that's going to be gone. And so many individuals, our clients, are extremely reliant on us helping them through the system, which is going to get even harder with the privatization. So I mean, overall, and that's just one of many discretionary programs that will be cut because of this.
And you mentioned Joining Forces for Families because that's something that we rely heavily on in our schools. And not too long ago, Prairie was looking at losing their Joining Forces for Families office. Unfortunately, a lot of people came and they advocated. And what they did instead of cutting the office is that now Joining Forces for Families, Prairie is also sharing space with Cottage Grove. So the worker works between Cottage Grove some days and then some Prairie. But that's a huge resource. I mean, that's our main go-to is our school is Joining Forces for Families because they provide that access to food pantries and helping, families navigate, the mental health system. So that would be a huge loss.
Yeah, my office alone covers 5 schools. So I mean, that's gone.
Cynthia, I'm hoping that you could talk a little bit more about the impact you see on English language learners and particularly on undocumented families.
I'm sorry, you said undocumented families as well? Well, I think looking at English language learners, and a lot it's still kind of up in the air in terms of what he's going to do with that. Part of the proposal was to end what they call bicultural education and bilingual, which means that they get the instruction in both languages, where in our school district, it's mainly English language learners. It's kind of that one language. It's not, really, I don't want to say catering, but not teaching their child in their first language. But that is something that is on the table, and that's going to be really a local, kind of a school district decision. Some school districts had said that's on the table along with gifted and talented, is that they would look to cut English language learner services. In terms of undocumented workers, I think that, or undocumented families, I think that's been an ongoing issue where these families have been hit hard. I know that there have been a lot of discussions about health insurance, denying them, health insurance. So I think, once again, the undocumented workers, that's something that's an ongoing issue. We're really struggling to reach out to those families. A lot of those families that we work with, they don't want to come forward if they're, being discriminated against in their housing because they feel like, well, if I say something or if they say something in their workplace about it, then, they're threatened to get turned in. And so we have to do a lot of outreach around our undocumented families as well.
I don't think I need a mic. I just have a question. Like, I know you guys are personally passionate about the 3 different topics that you guys are speaking about. But what would be one specific thing within your 3 topics that you would want to say from being cut? For example, would you like TANF or something like Milwaukee school system? What would be one specific thing that you guys would want to say?
In terms of protecting or in terms of?
Anything personally, not with the media, it's like what you guys personally.
I mean, I think some of the extracurricular programs that we offer for student learning, the academic piece, is very critical. I mean, it's not just where we're looking at-risk students, low-income students. We're talking about pregnancy prevention programs, alcohol, and drug prevention. So those programs are really critical to our school, the extra reading support. So many of our children are struggling with their reading, and to cut these programs, it's just going to be devastating. So I really think that keeping those programs into place, that helps students with their academic, as well as the social piece, is very, very important.
There's all sorts of things that I would not have ever thought would be true today, a month ago. And one thing I'm most inspired by over this last 3 weeks is to see all the people who finally, for some combination of the audaciousness of the attack, it's, kind of weird, exempting some people and, and the timeline he put it on, whatever happened, that we have had resistance to this blow up the way it has in Wisconsin is an incredibly inspiring thing. It is inspiring a lot of people here and a lot of people all over this country to stand up. I think the one thing I fear is that we will lose this battle. At some point, this crap will pass. And I think the wrong lesson to take from that was that we shouldn't have bothered. I think the real lesson is that we need to continue. And that's this has been, if you've been up at the Capitol, if you've been inside the Capitol, if you've been at the rallies, if you've been writing your senators, if you've been cutting checks, whatever you are doing, do more. And do more even when you get completely outraged that they didn't listen yet. So that's my one thing.
Well, I would definitely echo that. And, the pendulum swings back and forth. And it started swinging back quite a bit now, and we have to make sure it keeps going in that direction. But the governor doesn't have a mandate to do these things that he's doing. I was listening to public radio this morning, and there was somebody on who was kind of talking about the last election, and he said, well, everybody looked at the economy and what was going on and what was happening and what wasn't happening, and they decided to turn the channel to something different and just, vote the bums out and vote somebody else in. And there are a lot of people wanting to turn the channel again right now, and it's going to be fascinating, all these recall elections, and I have no idea how that's going to come out. But getting back to the question, if I, sort of the one thing that I'm most interested in is preserving the access of low-income families to Badger Care Plus, and that means far more than the kind of visible piece of where's the income eligibility going to be set, but all the other things that affect enrollment. I mean, people think that there's been this huge increase in enrollment since Badger Care Plus was initiated in February of 2008. I think it's an increase of like 280,000 people since then. A lot of that's because of the economy, clearly what's happened over the last few years. A lot of it is because we carefully, I had some hand in this on the advisory committee that developed it, but the state removed the barriers to enrollment. And the state also said all kids are going to be eligible, which had this clear message then that really got through to a lot of lower income families who'd already been eligible and weren't participating. But removing red tape is really critical, and restoration of red tape is real high on the priority list for the new administration.
Okay, we've reached the end of our time, so we have one more announcement from a student before we have some wrapping words from
Thank you, John, Laura, and Cynthia very much, and thank you, Callie, and Tracy, Anna, and Sephra, who couldn't be here for all of this. A lot of the students here, including myself, we're trying to, just build a community around our frustration or our outrage. We had our first meeting last Thursday, social work student action, for lack of a better name. But we're meeting again tomorrow morning, and if anybody can make it and has ideas or muscle or sweat or fear, please come on by. In room 315B, 9 a.m., social work building. Thanks.
Thank you all very much for coming. Let's give a big hand of applause. Okay, we're done. There is that event on the Badger Care, or not Badger Care, pardon me, on the new Badger Partnership, other Badger, at 7 o'clock in the Humanities Building that has started a few minutes ago if you were interested in that.